Good morning. I'm going to talk about medical practitioners number 2, hospital staff. The people who work in any type of workplace, including its hospital, are called the staff. The medical staff in British hospital belong to one of four main groups. The first one, a pre-registration house officer, or PRHO, or house officer, is a newly graduate doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor. 2. A senior house officer, SHO, is in the second year of postgraduate training. The title is New Foundation Year 2 Doctor, but the old terms senior house officer and SHO are still used. 3. A specialist registrar is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. And 3, a consultant is a fully qualified specialist. There may also be some associated specialties, senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all the medical staff. Medical terms. Consultant physicians and surgeons are responsible for a specific number of patients in hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the guard, where they will receive treatment and care. The junior doctors clear them, take their medical history, and examines them. Some time later, the registrar also sees the patient and may order investigation or test, for example, X-ray or ECG, make a provisional diagnosis and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular guard rounds. When the management of the patients is discussed with the registrar, consultants also decides when a patient is ready to be discharged. On the guard round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant care. Shifts. Junior doctors now normally work in shift, which means they normally work for 8 hours every day, for example 7 a.m. to 3 p.m., and are then free until 7 a.m. the next day. After a week, they change to a different shift, for example 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call, available to return on the hospital if necessary. From 5 p.m. to 9 a.m. the next day, days on call are set out in a rota. or list of name and times. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trying to contact them. That's it. Exercise. 6.1. Make word combination using a word from each box. Associate, specialist, house officer, on call, provisional diagnosis, radio pager, and word round. 6.2. Make the description with the job's title. Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 60. This is a consultant. The steward has just started the second year of the foundation program. This is a specialist registrar. Dr. Singh has his training as a surgeon. This is the SHO. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. This is a BRHO or house officer. And Dr. Miller is in charge of the medical staff in the Birmingham Hospital. This is a medical director. 6.3. Are the following statements true or false? The number 1. A medical graduate becomes registered 2 years after graduation. False. The system of training doctors in Britain is called the Foundation Program. True. The name senior house officer is no longer used in Britain. False. The consultant is usually the first doctor to see new patients. False. When working in shifts, all doctors take turns to be on call. True. 6.4. Complete the text of a PRHO describing her job. When I get to the guard, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admission. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients with basically involves taking a history. On Tuesday and Friday morning, the consultant does her guard round, and I have to make sure I completely up to date on her patients. After that, there are usually lots of things to do, like writing up requests for blood test, and so on. In afternoon, I have to prepare for any patients who are to be discharged to the next day. They're usually happy to be going home. And then, of course, there are the lectures and tutorials in the afternoon program on Monday and Wednesday. Thank you. Haz combinaciones utilizando las palabras de cada caja. Especialista asociado, oficial de casa, en guardia, diagnóstico provisional, localizador y turno en guardia. 6.2. Combina las descripciones con sus títulos de trabajo. El Dr. Graham ha sido pediatra durante 8 años y es responsable de tratar a los niños. Eso es un consultante. El Dr. Stewart acaba de comenzar el 2º año de su programa de fundación. Eso es un registrador especializado. El Dr. Singh ha comenzado su formación como cirujano. Es SHO. El Dr. Phillips acaba de graduarse y está trabajando en un hospital en Birmingham. 6 el house, eso es el oficial de casa. El doctor Miller está a cargo del personal médico en el hospital de Birmingham. Oficial de casa. 6.3. Dice si son falsas o verdaderas. Un graduado de medicina se registra 2 años después de graduarse. Falso. El sistema de formación de médicos de Gran Bretaña se llama Programa de Educación. Verdadero. El nombre de oficial de casa senior ya no se usa en Gran Bretaña. Falso. El consultor suele ser el primer médico en ver a los pacientes, en ver a los nuevos pacientes. Falso. Cuando trabajan por turnos, todos los médicos se turnan para estar de baja. Verdadero. Complete el texto de una PRHO describiendo su trabajo. Cuando estoy en guardia, la primera cosa que hago es hablar al oficial de casa que está en labor durante el turno para encontrar si hay alguna nueva admisión. Luego generalmente veo a las enfermeras. Él me dice si hay algo que debe ser atendido urgentemente, como una línea intravenosa. Luego en la mañana chequeo si hay algún nuevo paciente, que básicamente es tomar el historial. En jueves y viernes en la mañana el consultador hace sus rondas de guardia y debo tomar en cuenta completamente para actualizarla con los nuevos pacientes. Luego de eso, regularmente hay muchas cosas que hacer, como escribir algunas recetas para los exámenes de sangre. En la tarde preparo algún paciente para que sea referido hacia el otro día. Ellos usualmente están felices de ir a casa. Luego, más tarde, en la tarde, hago lecturas y tutoriales del programa del lunes y del miércoles. Es todo, gracias.